In this video, we will demonstrate nurse-client therapeutic communication throughout the phases of the nurse-client relationship. Throughout the video, we will explore specific verbal and nonverbal techniques, as well as bridges and barriers to nurse-client relationship. We will also apply Swanson's theory of caring to the specific scenario. In this scenario, we have a 49-year-old premenopausal woman suffering from abdominal pain. After conducting tests, nurses conclude that she is pregnant. I'm Nicolette, and I'll be playing the role of Mrs. Smith.
Hi, I'm Sarah, and I'm going to be playing Nurse Sarah, or the bad nurse.
Hi, I'm Louise. I'll be playing Nurse Louise, the good nurse.
I'm going to go check in with Mrs. Smith. She was recently admitted with symptoms of abdominal pain, nausea, and vomiting.
Okay, is that the woman in room 300 that is 49 years of age with 3 children and 1 grandchild?
That's the patient.
Okay, I'll check in with you later.
Hello, Mrs. Smith. My name is Sarah.
Hi, Sarah.
I'm going to be your nurse today. Would you like me to call you Mrs. Smith, or is there another name you'd like to go by?
No, Mrs. Smith is fine.
Okay. I'm going to ask you to change into this gown for me. Do you need any help with that?
No, I can do it myself, but thank you.
Okay, no problem. You all set, Mrs. Smith?
Yeah, you can come in.
Okay, so you have been experiencing overactive nociceptors due to the release of prostaglandins in your hypogastric and iliac regions. Is that correct?
Excuse me?
Nurse Sarah overused medical jargon to the point of confusing the patient. This is a verbal technique that can go wrong when used incorrectly. I will show you the correct way to include medical terminology in a nurse-patient interaction. It seems that you've been experiencing discomfort in your lower abdomen. Is that correct?
That's correct.
And is it also true that you've been experiencing occasional nausea and vomiting?
That's also correct.
Nurse Louise used terms the patient was able to understand while making sure the terms were specific to the problem. That way, the nurse and the patient could come to a mutual understanding. All right, Mrs. Smith, I'm going to take your vitals now, okay? So just breathe in and out for me, okay? Take a deep breath for me. Alright, everything sounds good. Okay. I have a few routine questions to ask you. Are you or do you plan to become pregnant? Are you currently sexually active? And do you remember when your last period was? So yes, 3 weeks?
Wait, hold on. What?
Do you want me to go through it again with you?
Yes.
Nurse Sarah didn't properly utilize the nonverbal technique of eye contact, also a form of non-contact touch. Instead of giving the patient ample time to respond to questions and keeping focus on the patient, Nurse Sarah flipped through the patient file while appearing uninterested and detached. I will show you how to properly utilize eye contact to enhance nurse-client relationship. I have a few routine questions to ask you. Is that alright?
Mm-hmm.
Are you or do you plan to become pregnant?
No.
Are you currently sexually active?
Mm-hmm. Yes.
Do you remember when your last period was?
About 4 months ago, but this is pretty normal since I'm premenopausal and I'm older, so.
Okay.
Nurse Louise asked the questions necessary to assess the patient, but also left time for her to respond and maintain eye contact with her, which made Mrs. Smith feel more like an equal partner in her interaction with the nursing staff, enhancing the sense of mutuality. I am going to have a few routine blood tests run. Don't worry, you won't be pregnant or anything. You have to do this for good measure. You know, doctor's orders.
Oh yeah. Oh wow, that would be horrible.
Yeah, it'd be crazy.
Nurse Sarah instilled false hope in the nurse-client interaction by revealing results of tests that were not yet conducted. If contradictory results come back, Mrs. Smith is more likely to feel a sense of mistrust towards her nurse, which is a barrier to effective communication in the nurse-client relationship. I will show you the correct way to maintain trust. There are a few routine blood tests that we have to run. Given that you are premenopausal and sexually active, there is a chance that you may be pregnant. We will bring back the test results as soon as possible.
Okay, thanks.
Nurse Louise made sure to inform the patient of the reality of the situation without instilling false hope. That way, even if the results of tests are not what she expected, Mrs. Smith will not feel like she was led to believe something that wasn't true by a nurse she should trust. This bridge contributes to the quality of the nurse-client relationship. Mrs. Smith?
Mm-hmm. Yeah.
Hi, I have the results of your blood test,
Okay.
and they indicate that you are, in fact, pregnant.
What was that? I couldn't hear you.
You're pregnant?
I'm sorry, I may be old, but I'm not
You're pregnant.
Nurse Sarah seemed embarrassed with the results as she spoke softly around touchy subjects. These kind of misuse of verbal communication techniques can induce embarrassment and awkwardness in the patient as well. I will show you how to avoid this kind of interaction. Mrs. Smith, this is Louise, your nurse.
Hi.
I have the results of your blood test, and they indicate that you are in fact pregnant.
By delivering news in a direct manner, no matter how unexpected or potentially upsetting the news may be, Nurse Louise conveys proper verbal communication. This can strengthen the quality of the nurse-client relationship.
No. That's not right. I can't be pregnant. I am going through menopause. I'm old. I have 3 kids. I have a grandchild. No.
Some of us can't even have children. You should be happy. At least you can get pregnant, you baby-making machine.
By bringing her own bias into the situation and refusing to empathize with the patient, Nurse Sarah allowed the barrier of lack of empathy to take over her relationship with the client. I will show you how to avoid bias and focus on the patient's needs.
No. I can't be pregnant. I have a grandchild. I have 3 older kids. I am going through menopause. I can't be pregnant.
You seem to be upset about this. I understand this is unexpected news for you. What can I do to help? I would love to offer some information about pregnancies similar to yours.
Okay.
Here's the pamphlet to go more in depth. Given that you have been through 3 pregnancies, I'm sure that you're familiar with basic prenatal precautions. I highly recommend that you start taking some folic acid vitamins, and many high-risk pregnancies turn out successful if the right precautions are taken.
Nurse Louise was empathetic rather than disconnected or biased. She also acted as a nurse educator by informing Mrs. Smith of pregnancy precautions and giving information on high-risk pregnancies. Empathy here serves as a bridge in the nurse-client relationship. Do you have a preferred OBGYN, or would you like to be referred to one?
I mean, I have one, but I guess I can go to new one.
Well, if you'd like, it's up to you, but if you'd like, I can refer you to an OBGYN with experience with high-risk pregnancies like yours.
Okay, alright.
Okay.
Sounds good.
Not a problem. The gynecologist can offer you more information about your pregnancy and other high-risk pregnancies like it, and they can really give you the utmost care there. Okay?
Thank you for all your help today.
Yep. Okay, bye.
Wait. What? Okay. Hi, are you all set today?
Nurse Sarah was disengaged in the termination phase. Instead of shaking hands and formally parting with the patient, she just said "K bye" and walked away. Nurse Sarah showed a lack of interest in her patient. Just because she and the patient were at the end of their interaction, it does not mean the interaction was complete. I will show you the correct way to non-verbally engage with the patient in the termination phase.
Thank you for everything today.
It was nice to meet and work with you, Mrs. Smith. Congratulations to you and your new family.
Thank you.
Are you all set today?
Yes.
Okay. By non-verbally engaging with Mrs. Smith in a handshake and a formal farewell, Nurse Louise left the patient with a positive feeling toward the nurse-client interaction. In Swanson's theory of caring, 5 processes of caring are outlined. These processes are knowing the patient, being with the patient, doing for the patient, enabling the patient, and maintaining belief for the patient.
The nurse demonstrated the process of knowing the patient by understanding that she is uncomfortable with the situation and picking up on her feelings.
By being physically and emotionally present to help Mrs. Smith adjust to her new reality, the nurse demonstrates the process of being with the patient.
By offering to refer Mrs. Smith to a new OBGYN and starting her on prenatal vitamins, the nurse demonstrates the process of doing for the patient.
By helping Mrs. Smith do everything she can to have the safest pregnancy possible, she is enabling Mrs. Smith to handle her high-risk pregnancy.
By reinforcing the idea that Mrs. Smith's pregnancy can be successful like many other high-risk pregnancies, as well as referring her to an experienced OBGYN, the nurse maintains belief that this pregnancy can be successful.